Good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in the last presentation, we'll discuss about the cranial nerve examination of the 1st to 10th cranial nerve. Now we'll talk about the next cranial nerves examination, which is 9th, which glossopharyngeal nerve. So in this, assess patient ability to swallow and discriminate between sugar and salt on posterior third of the tongue. Next cranial nerve is 10th, which is vagus nerve. So the glossopharyngeal and the vagus nerve are usually tested together. In the pharynx, cranial 9th is primarily sensory and the cranial nerve 10th is mostly motor. Observe the patient as he or she swallows a small amount of water. If ask if he or she frequently chokes on food or has trouble swallowing. Dysphagia means difficulty in swallowing, can often be seen after neurological procedures or CVA stroke. Depress a tongue blade on posterior tongue or stimulate posterior pharynx to elicit gag reflex. Note any hoarseness in voice. Check ability to swallow. Have patient say aha. Observe for symmetric rise of vulva and soft palate. Next is the spinal accessory nerve. In this, ask the trapezius and sternocleidoid muscles. Trapezial muscle is assessed by examiner. Place the hand on patient's shoulder. Ask the patient to shrug his or her shoulder and observe the strength. Next is sternocleidoid muscle. So sternocleidoid muscle, that is SCM muscle, is examined by examiner. Place hands on one cheek and ask the patient to turn his or her head against therapist hand as the movement is registered, and repeat the test on opposite. So it will be abnormal in the CVA. Next is the hypoglossal nerve, which is the 12th nerve. So hypoglossal nerve is tested by ask the patient to open his or her mouth, stick out his or her tongue and wiggle it side and side. When patient protrudes the tongue, note any deviation or tremor. Test the strength of the tongue by having patient move the protruded tongue from side to side against a tongue depressor. The tongue should be midline. Observe for asymmetry, atrophy and fasciculations. Carotid endarterectomy is a common cause of dysfunction of the cranial nerve 12th. Thank you.